giving you freedom to move without punishing your knees. Cycling, whether on a stationary bike or on flat terrain, is another excellent choice. The elliptical machine, Tai Chi, gentle yoga, all wonderful options. And don't forget about strengthening the muscles around your joints. Strong quadriceps, hamstrings, and glutes act like a safety belt that absorbs impact with every step, protecting the cartilage underneath. Next, weight control. The math here is brutal but honest. Every extra pound on your body isn't just 1 pound on your knees, it's way more than that. When you walk, the force your knee bears is 3 to 6 times your body weight. That means losing just 10 lbs can remove 30 to 60 lb of force from your knees with every single step. Imagine the relief that gives your cartilage after a day of thousands of steps. Weight loss is one of the most powerful interventions you can make to slow arthritis and reduce pain. Then there's anti-inflammatory nutrition. Tori, arthritis isn't just mechanical wear. It also involves chronic low-grade inflammation that speeds up cartilage destruction. A diet that fights this inflammation can create a much friendlier environment for your joints. Focus on omega-3 rich foods like salmon, sardines, walnuts, chia seeds, and flax. Fill your plate with colorful fruits and vegetables packed with antioxidants. Blueberries, strawberries, spinach, broccoli, peppers, turmeric with black pepper to boost absorption, and ginger are powerful natural anti-inflammatories you can add to meals. On the flip side, cut out what feeds inflammation: sugars, refined carbs, trans fats from processed foods, excess red meat, and foods cooked at very high temperatures. Now, what about supplements? The supplement world is a jungle. So let's stick to what has scientific backing. Hydrolyzed collagen provides the building blocks your body needs to make more cartilage. Studies suggest it may help reduce pain and improve function, though it doesn't regenerate cartilage completely. Glucosamine and chondroitin are natural cartilage components. The scientific evidence is mixed, but many clinical guidelines suggest that together they might provide mild to moderate pain relief and possibly slow cartilage loss long term. They seem to work best in mild to moderate arthritis. Oral hyaluronic acid is a key component of synovial fluid, your joint's lubricant. Evidence is weaker than for injections, but some studies show improvements in pain and function. Just know that supplements aren't drugs. Their effects are slow, taking months of consistent use, and they don't work for everyone. But because they're very safe, they're often worth trying as part of an overall plan, always under professional supervision. When the foundation isn't enough, modern medicine gives us more direct tools. These aren't magic cures, but they can change the course of disease in ways that were unthinkable 20 years ago. Injectable hyaluronic acid, also called viscosupplementation, is a well-established, effective therapy. It's literally like changing your car's oil. We inject this gel directly into your joint to restore the synovial fluid's viscosity and cushioning ability. It doesn't repair structural damage, but it makes everything run smoother, relieving pain and stiffness for months and allowing better rehabilitation. Platelet-rich plasma, or PRP, is where regenerative biology enters the picture. We use your own blood to create a super concentrate of growth factors. We draw a bit of blood, spin it in a centrifuge to separate components, and keep a small fraction of plasma loaded with platelets. Why platelets? Because they're like biological bombs packed with proteins that signal your body to start working. When we inject this PRP into your joint, it powerfully reduces inflammation, calms pain, and stimulates your remaining cartilage cells to function better and protect the cartilage matrix. PRP doesn't create new cartilage from nothing, but it dramatically improves the biological environment in your joint and gives your body's natural repair mechanisms a boost. Mesenchymal stem cell therapy is the most advanced and promising field in biological joint therapy. These cells, harvested from your own fat or bone marrow, are like orchestra conductors for tissue repair. Initially, we thought their magic was directly transforming into new cartilage, but today we know their main power is different. It's called the paracrine effect. Once injected, they release a cocktail of molecules with potent anti-inflammatory and immune-modulating effects. They protect your remaining cartilage cells from stress and death, call other repair cells from your body to help, and can even slow disease progression. This is a real option for moderate to severe cases in patients looking to postpone or avoid joint replacement. and results in pain relief and improved function are very promising. When damage is very large or very localized, sometimes we need surgery. But surgery doesn't always mean total joint replacement. For specific holes or defects in cartilage, like especially in younger active patients, we have very sophisticated repair techniques. Microfracture is a bone marrow stimulation technique where we make small holes in the bone beneath damaged cartilage. This causes controlled bleeding that brings stem cells from bone marrow to the area, forming a clot that matures into a fibrocartilage patch. It's not the original tissue, but it can fill the defect, relieve pain, and restore function in small injuries. Autologous chondrocyte implantation is much more sophisticated and the closest thing to real regeneration we have. It's done in two phases. In the first surgery, we take a small biopsy of your healthy cartilage from a non-weight bearing area. We send it to a specialized lab where they grow your own cells for weeks until we have millions. In a second surgery, we implant these new cells into the defect, often on a collagen membrane, so they generate new hyaline cartilage, very similar to the original. It's the only technique that truly regenerates high-quality tissue. The research frontier includes intelligent scaffolds and biomaterials. Tissue engineering combines cells, growth factors, and biomaterials. These biodegradable scaffolds are implanted in the defect. They don't just fill the hole, they're designed to release growth factors in a controlled way and attract your own stem cells, guiding organized, high-quality regeneration. So, where does this leave you? How do you turn all this information into a concrete, personalized action plan? Forget about 24-hour cures. The real secret to long-term joint health isn't a secret at all. It's a strategy built on three fundamental pillars. Build a solid foundation. This is your daily non-negotiable work. Move intelligently and consistently. Lose weight if you need to. Every pound lost is a huge victory for your knees. Eat to reduce inflammation, not increase it. And always consider evidence-based supplements with your doctor's guidance. This pillar is non-negotiable. It's the foundation everything else is built on. Consider biological therapies. If pain persists despite your efforts on the first pillar, don't resign yourself. Talk to an orthopedic specialist or sports medicine doctor. Ask directly if you're a candidate for injections, PRP, or even stem cell therapy. These therapies can reset your joint's biological environment, lower inflammation, reduce pain, and give you years of good function, allowing you to return to an active lifestyle. Explore modern surgical options. If the damage is specific or very advanced, remember that surgery has evolved enormously. Not everything is a joint replacement. Good diagnostic imaging, like an MRI, will tell you if focal cartilage repair is an option for you. Your first step today: take control. Stop being a passive patient waiting for a magic pill and become the active manager of your joint health. The first practical step is scheduling an appointment with a specialist. You need an accurate diagnosis to know exactly where you stand, what degree of wear you have, and which of all these options are most realistic and appropriate for you. Don't be fooled by advertising and sensational headlines. Seek information from reliable sources. Ask questions at your appointment. Understand your body and your condition. Look, regenerating your cartilage in 24 hours is a myth, but caring for, protecting, nourishing, and improving your joint health is an absolutely achievable reality. It requires knowledge, personal commitment, and proper guidance from a professional. The fight against joint degeneration isn't a sprint, it's a marathon. And today, with the information you now have, you're better equipped than ever to run it and win it. Stop searching for the miracle secret and start building solid, lasting joint health day by day. Your future self, the one moving with less pain and more freedom, will thank you deeply for